Good evening, one and all. On behalf of Dr. Agarwal's Institute of Optometry, I extend a warm welcome to each and every one of you for the 38th episode of Optometry series. I would like to take this opportunity to thank my team members, Ms. Anshika ma'am and Ms. Meenakshi. Hi, Anshi ma'am. Yes. The topic for today's child's eye health. I would like to ask Anshika ma'am to introduce our today's moderator.
Hi Gomati, I'll give a very small brief about Dharani ma'am. I think we'll have a better interview by the MC. Dharani ma'am has been working very closely with myopia and children. And definitely, when the theme of World Sight Day today is child's eye health, this would have been a wonderful platform for us to have Dharani ma'am to explain about how we as optoms can take care of a child's eye health. So, being my teacher, also, I'm very happy that Dharani ma'am could make it. So over to you, the MC for the day.
I would like to call Dharnesh today, the MC, to introduce our moderator.
Good evening, one and all. I am Dharani, studying second year bachelor's in optometry at Dr. Agarwal's Institute of Optometry. I am happy to welcome our today's moderator, Dr. Dharani Ramamurthy. Dr. Dharani ma'am is a professor of optometry at the Saara Medical College and Hospital and Research Center. Her academic journey begins with the bachelor's degree in optometry from the Erect School of Optometry, and she further advanced her expertise with PhD from Anglia Ruskin University in Cambridge, London. Her thesis, titled Effect of Family History of Myopia and other known as Risk Factor on Myopia Progressions, is a testament to her commitment to advancing our understanding of myopia. She has held pivotal roles, including the postdoctoral research fellow at the Shashvi School of Public at the National University of Singapore and assistant professor of SRM University. Her extensive clinical and research experience, further highlighted by her, worked as a senior optometrist and faculty at Sankara Nethralaya and Elect School of Optometry. Her contributions to the field have been recognized with prestigious awards, including OPO Bernard Gilmartin Award from the College of Optometry in UK for her publications titled Worldwide Prevalence and Risk Factor for Myopia. This landmark work summarizes global patterns and trends in myopia prevalence and evaluates associated risk factors. Ma'am has been honored with the International Myopia Institute Travel Grant in September 2023, reflecting on her ongoing influences and recognition in global optometry community. In addition to her impressive list of publications, Dharani ma'am has been an invaluable reviewer for several renowned international journals, and such as PLOS One, Investigative Ophthalmology and Visual Science, Optometry and Vision Science, and Scientific Reports. With over 25 years of experience encompassing clinical work, teaching, and research, Dr. Dharani ma'am expertises with fast and deeply impactful. We are truly fortunate to have with us today to share her insight and experiences. Thank you so much, ma'am, for joining with us today.
Thank you so much for the introduction.
Thank you, ma'am. The presenter for today is Ms. Shivani, third year's bachelor's in optometry student at Dr. Agarwal Institute of Optometry. Ms. Shivani, please start your presentation.
Thank you, Dharanish. Today's topic is child's eye health. Introduction. Vision plays an important role in children's physical, cognitive, and social development. More than 1 in 20 preschool age children and 1 in 4 school age children have a vision disorder. Uncorrected vision problems can impair child development, interfere with learning, and even lead to permanent vision loss. Early detection and treatment are critical. Visual functioning is a strong predictor of academic performance in school-age children, and vision disorder of childhood may continue to affect health and well-being throughout the adulthood. The total population of India, as per current estimates, is 1.38 billion, estimated at an annual growth rate (AGR) of 1.29% for the year 2020. there are 399 million children, 29% of the population. Globally, at least 450 million children have an ocular condition that needs treatment, with 90 million children are living with some form of visual loss. 448 million children and adolescents have refractive errors. 90 million children and adolescents live with visual impairment. 2 million are living with blindness. 30 million have moderate to severe vision impairment. 58 million have mild visual impairment. The prevalence of vision loss in children varies considerably within and between countries and regions. Malik et al. Reported that children who are blind are more likely to childhood than a child with good vision, especially in low-income countries. In India, there are estimated 4.95 million people blind, 0.36% of the total population. 35 million people visually impaired, 2.55%, and 0.24 million blind children in India. 82.3% of blindness among adults and 35% of blindness among children is due to avoidable cases. Cataract and refractive error remains the leading cause of blindness and visual impairment, respectively, in India. Global burden. The cumulative loss of gross national income due to blindness increased almost 3 times in the past 2 decades. The estimated net gross GNI due to blindness in India is Indian rupee 845 billion. The cumulative loss of GNI due to avoidable blindness in India is Indian rupee 11,778.6 billion. Nutrition and eye health. According to the World Health Organization (WHO), approximately 149 million under the age of 5 were stunted, too short for their age, due to chronic malnutrition in 2020. Additionally, 45 million children were too thin and for their height, and 340 million children suffered from micronutrient deficiencies. In India has one of the highest rate of child malnutrition in the world of about 35% of the children under 5 years are stunted, 19% are thin, and 32% are underweight. Micronutrient deficiencies, particularly of vitamin A, iron, and zinc, are also prevalent, contributing to various health issues, including vision problems. Malnutrition. Malnutrition can lead to deficiencies in these critical nutrition, causing a range of ocular issues such as night blindness, xerophthalmia, delayed visual development, decreased risk of infections. Malnutrition weakness, the immune system making children more susceptible to infections like conjunctivitis and other ocular infections. Vision impairment and blindness, impact of learning and development. The global rise. At present, myopia booms like a social burden. Graphical representation shows the number of people estimated to have myopia and myopia for each decade from 2000 through 2050. Myopia. Myopia is increasing at an alarming rate worldwide, especially in urban areas. As per WHO, myopia is projected to increase from 22% in 2000 to 52% of world population by 2050. Both genetic and environmental factors contribute to the increase in myopia. The economic burden of uncorrected distance refractive error, largely caused by myopia, was estimated to be $202 billion per annum. Myopia. However, myopia brings further vision challenges because high myopia increases the risk of pathological ocular changes such as cataract, glaucoma, retinal detachment, and myopia, macular degeneration. All of these cases cause irreversible vision loss. Also, in today's digital world, screens are indeed unavoidable and play a significant role in education, work communication, entertainment. While screens often sustainable benefits, their extensive use necessitates careful management to prevent eye strain and myopia progression. Strategies such as setting screen time limit, ensuring proper ergonomic, and encouraging regular breaks and outdoor activities can help mitigate the adverse effect of eye health while accommodating the essential role of screen in the modern life. The tabular column shows the prevalence of myopia in each decades and different regions of the world. The graphical representation shows the prevalence of myopia in different age groups. Effects of screen time on myopia. Research has demonstrated a correlation between increased screen time and higher prevalence of myopia. Studies suggest that children who spend more time on screen are at a greater risk of developing myopia compared to those who spend more time outdoor. Continuous focusing on near object strains the eye and may contribute to elongation of the eyeball, leading to myopia. Accelerated progression in existing myopia, digital eye strain, critical period. Children are particularly vulnerable to the effect of screen time of myopia because their eye are still developing. Excessive screen time during these formative years can significantly impact the development and progression of myopia. What can be done? Social school screening, the role of school in promoting eye health. School plays a crucial role in promoting eye health among children, conducting vision screening programs for early detection and problem, and providing educational and awareness by promoting health educational curriculum, parental involvement, screen time management, outdoor activities, providing nutritious meals rich in nutrients essential for eye health, such as vitamin A, omega-3 fatty acids, and antioxidants like lutein and zeaxanthin. These nutrition are vital for maintaining good vision and preventing eye disorders. Effect of randomized interventional school-based vision programs on academic performance of student grades to 3 to 7. A cluster randomized clinical trial. Student in grade 3 to 7 who received eyeglasses throughout a school-based vision program achieved better reading scores over 1 year. Particularly, large gain for girls, student in special education, student performing in the lowest quartile at baseline. Importance of regular eye examination. Many vision problems in children such as myopia, hyperopia, and astigmatism often do not show obvious symptoms. Early detection allows for timely intervention which can prevent avoidable visual impairment as a result of amblyopia. This can promote academic success, developmental milestones, and better behavioral changes among children. Remote screening. It is essential that 40% of children are blind from each condition that could have been prevented or could be managed if the child had access to eye care service. To improve child's eye health and reduce disability, comprehensive service are needed at community, primary, and secondary, tertiary level. The Lancet Communication reported spectacles to be one of the most effective health intervention of children, reducing the case of failing a classes by 44%. School-based eye health program offers an effective, cost-effective model of deliver eye care to school children and are efficient in respect to time and resource. Eye health and substance development goals. Vision has a significant impact on the health and well-being of people across the spectrum of life. The United Nations System Development Goals are universal call of action to build a healthier world for their entire population and the environment by 2030. The 17 SDG are integrated, which mean they recognize that action in one area will affect outcome in other. Throughout the World Report of Vision, the WHO recognizes the important contribution of vision to the SDG, highlighting the close link between eye health and virtually every major issue in development. SDG of UN. These are my references. Thank you.
Thank you, Shivani. That was an excellent presentation.
Thank you.
Thanks, Shivani. Now request Dharani ma'am to add her valuable points.
I would first like to thank and congratulate DAIO and team and the speaker for bringing up this topic rightly just before the World Sight Day 2024, because IAPB is having the theme for this year's World Sight Day as child eye health. They want to prioritize child eye health. This is very important for India, as 1 out of every 1,000 children who are in the age range up to 15 years are blind in India. So this is really a major concern, and this is inclusive of higher magnitude of refractive error also. So activities like increasing the awareness about child eye health and eye care, as well as initiatives to prevent visual impairment and blindness are very crucial at this time point. As the speaker has correctly outlined, this topic is actually related to 5 out of 17 SDGs by the UN. So I can just list out those SDGs. The SDG 3, which is good health and well-being, of course, our eye health will come under this, and SDG 4, which is quality education. So since children are the future generation of India and across the globe, it is very important that we give them the best eye health care services in order to improve their educational standards. And if we provide SDG, if we really work towards SDG 3 and 4, we are indirectly going to achieve SDG 8, which is work and economic growth. So this is going to have an impact, indirect impact on the SDG 1, which is no poverty, and as well as SDG 2, which is no hunger. So I think this is the right juncture for all of us to act upon integrating the child eye health and prioritizing child eye health in our primary eye care practices. So I would like to move on to question answer session. If there are any questions for the speaker as well as for me.
Please repeat, ma'am.
Are there any questions from the audience?
Yes, ma'am. There are two questions, ma'am. Two
Yeah,
questions. So this is on YouTube. What would be the risk factors of developing pathological conditions, other pathological conditions other than myopia?
That is risk factors for developing pathological conditions
Other
in
than
case
myopia.
of other than myopia in children, is it?
Yes, ma'am.
In pediatric
Children,
age group.
yes.
See, myopia, we know that it is a combination of genetic and environmental factor. So other pathological conditions, like if you take congenital cataract, congenital retinitis pigmentosa, and retinoblastoma, these are genetically inherited from the parents. And of course, for congenital cataract, we also could also be due to maternal prenatal infections or maternal infections and malnutrition in the mother during pregnancy. Hope I have answered that question.
Yes, ma'am. There is another question, ma'am. From Harin Farana. What are the roles of optimists in taking care of child's eye health?
Sorry, what are the roles of?
Optometrist.
Optometrist. Okay, optometrist and child eye health care. Okay, this is a very good question. We all have a huge role to play. I would, because we know that from the statistics and data which the speaker has presented today, there is a huge burden of reversible blindness, for which refractive error is one of the conditions. So we as optometrists have a major role in managing the refractive error by prescribing appropriate spectacles. Especially if you take for myopia, we need, first of all, as primary eye care professionals, we have to be aware of the myopia control spectacles. Okay, we should know about these lenses, how they work, the optics of these lenses, and what are the indications for prescribing these lenses. That is a control measure. Okay, that is after myopia has set in. But it is because primary eye care deals with the prevention of any such reversible eye conditions. It is our duty to prevent myopia even before it sets in. Okay, because once myopia sets in, it is likely that the child is going to progress and may be at a higher risk of developing complications, pathological myopia complications. So we have to educate the parents as well as the children and teachers, because these three are the important stakeholders for who are offering and taking care of the children. Okay, so we need to educate them about the importance of increasing and promoting outdoor time, outdoor games. Okay, and we need to educate them about the advantage and uses of being in bright daylight and taking frequent breaks. So we have to basically give them awareness about eye health care in order to prevent myopia. So in addition, WCO has actually put forth five factors where we as optometrists play a role. So that is, we need to examine them, counsel them, educate them, examine them at frequent intervals, because many parents are not aware that if their child is at higher risk of developing myopia, okay, they have to bring their children for frequent eye checkup, even more frequently than an yearly pattern. Okay, so these things we have to educate them.
Thank you, ma'am. There is another question, ma'am. So shall we go to the next question now, please?
Yeah.
So what are the different complications we can see in the future due to sustained myopia in children?
In myopic children,
yes,
the future complications.
So
the future complications, I think you all might have read in ocular diseases. Okay, there are lots of pathological myopic changes, with the earliest change being the temporal crescent, okay, which can be seen not only in high myopes but also in moderate myopes. So the moment we see the temporal crescent, it is a clue that this child is going to go in for a progression. So the pathological complications that these children may face in future include the myopic macular degeneration, retinal detachment, which are sight threatening, and they are also at an increased risk and predisposed to develop cataract and glaucoma in future when they are in later in adulthood. So all these are sight-threatening conditions. So these are some of the complications which can result from myopia. If their myopia is not going to be controlled and if they are going to progress to a very high myopia in adulthood.
So that's it for the day, ma'am. So we don't have any more questions. So thank you so much, ma'am,
Okay.
for answering for all the questions. So this will come to the end of the session, ma'am. Would you like to add
Thank
any
you.
more
Thank you
comments
so
from-
much for the Agarwal Institute for inviting me for this seminar series, your student seminar series.
Thank you
Thanks,
so much,
Anshi.
ma'am.
Thank you, ma'am, for giving all the inputs,
bye.
ma'am.
Yeah.
Bye.
Yeah, thank you so much. Yeah.
Thank you.
Bye.
Thank you, Dharani. Thank you, Anshi, ma'am. Thank you, dear audiences, for giving us the continuous support towards Optometry series. If you have any questions about this session, please post your questions in the comment box. We'll get back to you with the answers. If you like this video, give a thumbs up and share with your friends. The announcement for the week is that admissions are open for a bachelor's, master's, fellowship, and internship in optometry at Dr. Agarwal's Institute of Optometry. For more inquiry on the admission, please follow the number that is given in the description box. We'll meet you in the next episode. Thank you. Thank you, ma'am.
Yeah, bye.